Let me turn to you first, Professor Lee. You really don't believe in lockdowns. You think they're pointless. Why?
Well, I think at the very beginning of the epidemic, in March, there were genuine reasons for concern. But I think for several months now, it's been clear that this virus is not the new plague that it was feared that it would be. And yet we've continued to act as if it is that new plague. We've also continued to act in this way despite major harms caused by lockdowns and despite very little evidence that lockdowns, social distancing, masks and all the other things that have been introduced actually work on a societal basis. So we're actually causing more harm, clearly causing more harm, both in terms of deaths and in terms of quality of life by the actions we're taking for a virus, for a disease that's within the envelope of many years within the last 30 years.
And yet, Professor Lee, in this country right now, cases are rising exponentially. So how do you stop the cases rising if you don't have a lockdown? Because the knock-on effect is we get more hospitalisations, more people ICU, more pressures on our health service, and eventually it won't be able to cope.
Well, I mean, my argument is if your health service or any health service isn't up to providing the care that's needed, you should increase capacity. What you shouldn't do is imprison your entire population and do epidemiological and virological experiments on people which don't have any way of being verified, which don't have any evidence to support them, and cause, as I say, cause great harms. There's also a problem that in this phase of the pandemic, people have equated positive tests with cases. Now, this isn't correct. This is simply wrong. In the normal winter, we never obsessively test the population for any virus to the extent to which this virus is being tested for. And the fact is, if you have a positive test but you're not unwell, you cannot be regarded as a case of this disease. You're just somebody who's got a virus. The only people who in a normal winter turn up as cases of this disease are people who are admitted to hospital, people who become seriously ill. And they're a very tiny proportion of the number of positive tests that you would do if you tested everybody. So the fact is that for people under 70, the infection fatality rate for this disease is 0.05%, which is about half of flu. And it's likely to be even lower than that because, of course, we don't truly know what the denominator is because we haven't been testing in the wider population. And many of the tests that have been done, the antibody tests, are the wrong tests to be doing because we should be testing people's T cells, which would show that a lot of people already have pre-existing resistance to this virus. So on very many levels, the approach to this virus, both scientifically and medically, but also in terms of societally, what we're doing with this is simply wrong. My view is that we should have no more lockdown. We should go back to living lives normally. We should travel normally. We should go to work. We should go out. And people who are vulnerable, people who are at risk of disease, the elderly, if they want to, they could be advised to look after themselves. But frankly, if I'm 70 or if I'm 80, I don't want to have many of the things that make life worth living taken away from me by government and government responses that infantilise the population and tell us that we can't make risk assessments for ourselves as we go about our daily lives.
OK, just before I bring in my other guests, I have to come back to you on that bit, Professor Lee, and that would inevitably lead to people losing their lives, people who are vulnerable and people who are elderly. Surely that's not acceptable.
Well, you're saying that nobody should die. I mean, we need to be able to have a grown-up conversation about death in our societies. The fact is, when you get to in your 80s, you have a higher chance of dying of all diseases. In the UK, at least, the average age of death is about 82. The average age of death of COVID is a bit older than the average age of death. So the fact is, there's no evidence that COVID is really impacting on the overall lifespan of the population. Yes, certain people are more susceptible to this disease, and it can obviously cause a nasty disease. But the fact is, this societal response is something that has never been done before. There are many diseases that kill millions of people a year. You have tuberculosis, malaria, AIDS, influenza itself, all cause more than 1 million deaths a year. This year we'll have some COVID deaths, which will be more than 1 million worldwide. But the fact is there are 70 million deaths every year, and next year we will have many fewer COVID deaths.
Professor John Lee, come back on that and what you've heard from Tomás Ryan there.
Well, we've heard too much of this during this entire pandemic. We hear epidemiologists giving sort of modelling-based suggestions for what we should be doing with our lives, and the fact is they've been conclusively wrong consistently forever, basically, about this. The fact is these simplistic and biologically naive models do not work on a population basis. They do not capture many of the important things in viral spread. These viruses, remember, have been around since the dawn of time. They've actually spread amongst our species since before we were on two legs. The fact is these things can spread whether or not they spread at very low population density. So the fact is, if we're implementing these lockdowns and these other measures, which are hugely disruptive and hugely damaging, the only thing that they may do is slow down the spread of the virus a little bit. But the fact is, in 6 months or a year or 2 years or 3 years or however long it takes, this virus will spread throughout the population and we will be where we're going to end up being. The only difference will be how big of an own goal have we caused in the meantime by the measures which have caused direct harms, which are greater than the virus. I come back to the point, at the beginning of this pandemic, people were worried that this was a very severe, very serious virus, a new plague. It isn't. It's quite clear that the infection fatality rate is comparable with flu. You can argue about whether it's a bit more or a bit less, but basically it's not a lot more, even in the vulnerable groups. And in many groups of younger people, it's a lot lower. So the fact is, this is not the new plague. This is a virus, as I say, which is within the envelope of winter deaths that we've dealt with for many years out of the last 30 and for many, many years out of the last 100.
Okay,
We've never done this before. This is a societal experiment and it's the wrong thing to do.